Dr. Derman, hey man, thank you so much for being here. I appreciate you taking your time. I know you got a busy schedule today, yeah, I'm super pumped to have you involved with Texas Chiropractic Association. I wanted to kind of open it up to you and find out a little bit about you and your practice, man. So,
Sure,
uh,
sure. Well, thanks for having me. I appreciate it. I'm looking forward to making some relationships with you guys. My background is I was actually born in Dallas, so I lived here all the way through growing up. I went to Hillcrest High School and survived public schools in Dallas. Then I kind of traveled around the country for my education. I was in the West Coast. I went to Stanford undergrad. I was on the gymnastics team there. And then kind of East Coast for 10 years. And I did a fellowship primarily in minimally invasive spine surgery in Chicago. And then I was recruited back down to Dallas to the Texas Back Institute where I practice now to be kind of the minimally invasive specialist in the group.
gotcha. So
And
you're
so
not in Texas.
I am originally from Texas.
There you go. Good. So, and then you spent some time out in Pennsylvania too. Is that right?
Yeah, so I went to the University of Pennsylvania for medical school. And then while I was there, I went to Wharton for business school because I just didn't have enough to do.
That's right, man. Absolutely. Yeah. I can relate, man. But we were talking a little bit about that too. And I think this might be interesting for some chiropractors, but we were discussing the business behind chiropractic and the business behind, medicine and things like that. Many people think that medical doctors really don't have to know much about business, but what can you say in terms of why that's important to what you do?
There's a growing trend toward doctors being employed. And when I say doctors, I mean on the medical doctor side of things, to doctors being employed by hospital systems. So they're basically just, they do their clinical work, but they don't have to worry about the business side of things. Mm-hmm. For me, I'm really interested in the business side of things. That's why I got an MBA, because I'm more entrepreneurial, and I like the idea of building something for myself. The thought of being kind of like a cog in this giant wheel for a hospital system is just not appealing to me at all. And so, I went through all this training, and when I was done with my fellowship, I can take out disc herniations and I can take care of spine patients. But fortunately, with the MBA side of things, I feel like I was more ready to come out and do the kind of business development side of things. And so that really involved initially not just sitting in my office waiting for people to show up, but kind of hitting the pavement. And so I'd say for the first 6 months, 4 days a week, I was in my shirt and tie, just walking in. I would walk into any office of anyone who would see me unannounced and just shake hands and drop off my business cards. Fortunately, those things paid off. And the other thing that we were kind of discussing is, I'm from this area. This is home. And so I plan to be here for my entire career, hopefully the next 30 years. And so it's really about building your business. And I think traditionally business was like a bad word, but it is a business. And if we're providing good care to our patients, then they'll be happy. And so your patient really is your customer. And providing good customer service is important. But by building my business the right way, it might be slower on the outset, but I feel like will grow kind of, and has grown exponentially as you kind of develop a reputation of somebody who really does care about your patients, is not ultra aggressive with surgery, really does try to exhaust all conservative non-operative measures before even considering surgery. And so I've developed quite a cohort of referral sources who send to me preferentially because they know that, you don't just go to Derman and get a surgery. We actually look at
that's the whole philosophy of when you're a hammer, everything looks like a nail, so.
Right. And so, the other thing for me is, spine surgery is great for certain problems. And we can talk about kind of the minimally invasive techniques that I use that I think is a vast improvement on traditional spine surgery. But there's things that we can't fix. And it's important to know what you can and can't fix with the tools that you have. And some of the hardest conversations I have with patients, and I have them every day, is yes, you have a problem in your spine. Yes, it is debilitating to you. But unfortunately, we as a spine surgery field don't have a good solution to this problem. And it's a hard conversation to have because you want to help that person. Yep. But the last thing you want to do is operate on them, and then they're still no better, and then you haven't helped anyone. And so it's really leveraging a team approach of, interventional pain with injections, chiropractic, physical therapy, all of these things together to help prevent people from needing surgery, or take care of people that just, it's not appropriate for them to have surgery.
Yeah. And some of that comes just into lifestyle, you know? So, I mean,
Oh, no doubt.
feeling, you know, I mean, just doing the things we need to do. And sometimes people would rather, hey, just cut on me, fix me, and I'm out, you know? So it doesn't work that way.
Quick fix. They want a silver bullet sometimes. And, you know, I tell them, like, listen, I only, even if you're going to have surgery with me, I'm only setting it up for you, right? Yeah. Like, I set it up, and then you've got to do the rest of the work to rehab and to live the rest of your life such that this is not a recurrent problem.
Yep, exactly. Which is, I mean, that's exactly what the chiropractic philosophy is, really. I mean, it comes down to the body is able to heal itself, you know, start least invasive, build the most invasive. And I think that's totally an appropriate way that you should approach patient care. And I like how you said, you know, I started my business slow. It wasn't because of lack of going out and marketing. It was because you're doing the appropriate thing, because some patients weren't surgical, you know?
Oh, absolutely. Yeah. 90% of my patients, they end up not having surgery. And that's a great number for me, you know, like, I'm proud of that number.
Yeah, exactly, man.
I tell them all the time, you know, my background's minimally invasive, and the least invasive surgery is no surgery.
Yep.
So if we can get away with no surgery and get you back to the things you want to do, hallelujah, then that's like the biggest win we can have.
And I know, well, you know, speaking of lifestyle too, I know you have a very active lifestyle. I know you're very in tune with health and wellness. And you mentioned gymnastics. You sent me a video of you doing a backflip. So what I want to know is, can you come to a TCA seminar and teach chiropractors how to do a backflip?
As long as there's other chiropractors around who can take care of us after we injure. So I was a gymnast growing up here, and then all the way through college, I was the captain of the team at Stanford and an All-American in my college years. So it was a big part of my life. In fact, I think my life was divided into two parts. It's gymnastics and then spine surgery afterwards. And the gymnastics part of things really did inform, you know, my current life, from, you know, lifestyle and drive and dedication, also to the importance of physical fitness and for my own mental health and physical health, and as well as that of my patients. So yeah. It really is something that I think about on a daily basis. Yeah. However, my wife told me I'm not allowed to do a backflip again.
All right. You're grounded.
When I told her I was going to do that, she said, "You're going to do what? If you break your neck, I'm going to kill you the rest of the way." So I can still walk on my hands. It's a good party trick.
Yeah, you gotta listen to the boss. I respect that. You know,
yeah, exactly right.
Happy wife, happy life.
Exactly.
But and you know, with what you do, I mean, just the amount of, and I was really curious about this too. You know, you do a lot with research as well too. So can you kind of explain a little bit how you blend the clinical side with also some of the research that you're involved with as well?
Yeah, absolutely. So, you know, one of the benefits of working at the Texas Back Institute where I practice is we're a big group and we're very research minded. And so it's not just like, hey, let's just do the stuff we learned in our training. Let's just keep doing the same old stuff. You know, when I started medical school, the first day they said to me something that stuck in my mind, which is that 50% of the stuff we're going to teach you is wrong, but we just don't know which 50% yet. And so, you know, there's just lots of room for improvement. And to me, there's so many unanswered questions. And part of the reason that I sought out spine as my specialty is because it's a problem that's not solved. There's still so much room for improvement. Unlike, you know, say knee replacements or hip replacements. Hip replacements are pretty great surgery. It's been pretty much the same for the last 30 years. So there's not a lot of room. It's not that exciting. There's not a lot of room for great improvement. But spine, there's tons of room. I mean, spine surgery, I hope that we look back 10 years from now and think, God, that was barbaric what we were doing. And if we don't, then we've failed, you know? So it's something that we should still keep pushing forward. And so the research component of it is my kind of drive to make this thing better and to answer these unanswered questions that we still have. You know, does this person need a fusion? Can we get away with just a decompression? How much better off are they if we do an endoscopic procedure versus a traditional spine surgery? And those are the questions that really get me excited. And research is what allows me to kind of explore that.
Yep. I think that's something too that is relevant to a lot of chiropractors is understanding some of those different, you know, which I hope we do more videos that kind of break down some of those different procedures that you're doing as well.
Yeah, I'd love to.
I think all that is super relevant. But what is something like, what is maybe like a technique or something that you do right now that you would say is something that sets you apart as a doctor or a clinician?
Yeah, when I came to town, I was like, oh, I'm this like minimally invasive trained guy. Like, nobody else is really doing these techniques. And I got out and I said, oh, hi, I'm Peter Derman. I do minimally invasive spine surgery. Everyone just like rolled their eyes. Like everyone says, I saw a billboard on the highway. It says everyone does minimally invasive spine surgery. And so really defining what that means has been really important, because it's become a marketing term. So if you're not saying you do minimally invasive surgery, then what the heck are you doing? You should say it, because there's no definition. Yeah. But the techniques that I use are different and unique from what's going on at 95% of the spine surgeries out there. What I will tell you, and we talked a little bit about this, is just as important as these techniques, and I would love to at some point go into some of the details about them, because I get excited about this kind of stuff. This is what I think about like while I brush my teeth and sleep at night. But just as important as the techniques is the philosophy. And so really trying to do less. And if you're doing surgery, if a patient has failed everything else, is really thinking about critically what problem they have and honing down on the smallest exact source of their pain, and then crafting the smallest surgery that we can to address that problem. So, people have scoliosis all the time, but, a lot of the times they have a single level radiculopathy, say an L5 radiculopathy at the bottom of big scoliosis. Well, a lot of people just look at the x-ray, don't even talk to the patient, say that person must be straight. And then they get rods and screws up their back. And I never met someone with rods and screws up their back that's like, I feel great, let's go play tennis. Like, that's not a thing. But if you listen to the patient and you really take the time to think about it, you can identify like, oh, they have foraminal stenosis at L5S1. I can just address that one level, and okay, their x-ray won't look great, but I can get them back to everything that they want to do. Yeah. And so that's what really excites me. And then from the technique standpoint, the key to minimally invasive, the overarching theme is not just small incisions, although I pride myself on making the smallest incisions around, just because I think that's, I don't know, it's my thing. But it's really what happens under the skin. And you guys would know this is more than me, probably. The traditional spine surgery is an incision down the center of the back, and then literally burning the muscles off the spine just to get to the spine. And so there's a lot of the long-term morbidity of spine surgery, and the reason that people are understandably hesitant to even consider the idea, and probably the reason why traditionally chiropractors didn't want to send, and probably still don't want to send to spine surgeons, is because you guys have to deal with the aftermath. Mm-hmm. And there's something called failed back syndrome. It's a real thing. There's an ICD-10 diagnosis code for the damage that is done by spine surgeons that creates lasting problems with people's backs. Mm-hmm. And that all comes from the collateral damage from getting to the spine. Mm-hmm. And so for me, the thought of doing that traditional open spine surgery, which is like a slash and burn thing, is repugnant. Like, I'm like, oh, I'm accomplished to a crime if I'm participating in that. And so it's all about protecting the soft tissues. So regardless of where I am, say the neck, the low back, front back side, whatever I'm doing, I never cut muscle. And that's the key to a fast recovery. Yep. And a complete recovery, right? So it's all about getting places, using kind of little portals and stuff like that to allow me to never cut muscle. The thing that I'm kind of really passionate about and really excited about kind of now and going into the future as I think what is going to define my career is endoscopic spine surgery. And so, traditional spine surgery is making an incision and seeing the spine. Endoscopic spine surgery is kind of an emerging technique that's a total paradigm shift. And it's the equivalent of like you get a meniscal tear and you get your knee scoped. Mm-hmm. I can put a camera down through an 8mm incision, put a camera down your spine. I never see your spine and look at everything on a high definition screen. And I can go down and clean out disc herniations or stenosis or whatever else, which allows me amazing view of things that I never would have gotten before, and does essentially no damage to the surrounding tissue. So, I'm able to go in like stealth-like, remove whatever the offending agent is, and then sneak out of there. And the patient gets one stitch under the skin They get a tiny little thing that looks like half a Band-Aid, and they go home like an hour later. So, I can do this and you can be home for brunch.
Yeah.
And a lot of my patients are just taking Tylenol after surgery.
Yeah.
And so, I had a lady in her 70s who would otherwise have required a fusion and was recommended to have a spinal fusion. So, you have a radiculopathy. I can clean out around that nerve. I think I can. And so we did this endoscopic procedure. She went home an hour later. She emailed my assistant the next morning. So like 19 hours from surgery, from the gym, from the elliptical.
Oh my God.
And I was like, yeah.
Sometimes you got to say, hey, calm down. You're like,
No, but I'm okay with it. Like, I want my patients to get back to the activities that they want to do. And so I'm actually okay with low impact activity as soon as patients feel up to it. So the endoscopic stuff is a total game changer. It's something that we obviously, I could talk for hours, but we could obviously talk more about it. I've got some videos and stuff I can show you and stuff like that.
Technology is just shifting everything. It's shifting surgery. It's shifting the way that we approach healthcare, the way that we communicate with people. So it's amazing to think about where we are right now and then what the future holds for all of it. My profession, your profession. So I think
definitely. And the endoscopic things, the endoscopic spine surgery really kind of was developed and caught on primarily in Germany and like East Asia, like Korea is very big in it. It hasn't really caught on in the United States to any significant degree. There's probably only a handful of us in the country that are doing it. And I'm really the only one doing it with any volume outside of the coast. So it's nice to be able to offer that to my patients. It's not something that, is in the typical vernacular of most spine surgeons, but literally every week there's somebody who I see that I'm like, this will allow you to avoid a fusion. And that's what gets me excited. Like that is a life-changing difference for somebody. Yep. So the ability to kind of continue to offer that to more and more of my patients is exciting to me.
Yeah. I love how you are so cutting edge, no pun intended on that, man. But, and even, beyond just surgery, but tell me a little bit about like, what is your approach with collaborative care with chiropractors, physical therapists? I mean, things like that. How do you approach
it? As I kind of alluded to, surgery is only a small percentage of what I do. And so collaboration, you said collaborative care, that is the key word. I really think of it as a team effort, and there's no one thing that people are going to do typically that's going to make them all better. These are complicated problems and they rarely stem from a single episode or incident, right? Like people need to change their lifestyle. They need to strengthen their core. They need to do all of these preventative things. And so I rely very heavily on, chiropractic and physical therapy, both before surgery and after surgery, by the way. And then collaboration is the key. And so I'm very, I put a lot of stake on communication. Mm-hmm. And so, anyone who sends me a patient, I either text them or call them after I see the patient every single time. Mm-hmm. Because it is important, because otherwise patients are jumping around. We're doing different messaging to the patients. Like it's just not good care. And so, I would encourage anyone who has a patient that they're even not necessarily even need to send to me, but are even wondering whether a spine surgery evaluation would be necessary. I'm very open. Anyone can have my cell phone number. Anyone can have my email address. And I really like when people reach out to me, even if they're sending me a patient, just to give me the heads up, because then I know that they sent me that patient, and then we can get on the phone or something and talk afterwards. Yep. And that's really the key, I think, to effective patient care and keeping patients happy.
I think that's the new generation of approaching is just open communication, making sure that we're all on the same page, because it's patients first, patient centric. And I get that vibe from you 100%. So yeah. I truly.
Otherwise, what are we doing? We're like faxing our notes back and forth. Yeah. Like it's 2020. Why are we sending faxes? And it's a little careful. You have to be a little careful with HIPAA stuff and text message, but there's ways to do it smartly so that we can like effectively take care of our patients.
Exactly. Yep. So, yeah. And I know I could tell just from getting to know you and meeting you that you're all about relationship building. And that's why I'm excited to grow a relationship with you and the TCA. And, I'm excited to see what the future holds for both of us. So
definitely. And feel free, as I said, to share my contact information with anyone who has questions after this or would like to reach out to me. I'm always I'm always happy to chat, and I will never, ever be unhappy about getting reached out to about a patient.
So, and Doc, I got one last question for you. This is kind of a controversial question. Okay, so we've had a lot of, I'm sure we'll get a lot of replies on this one, but I got to know, what's your favorite jam from the 90s?
Oh, wow. I would say the first song, this is maybe a little a modification of the question, but the first song that I ever knew all of the words to was Mr. Jones by the Counting Crows.
I love that song.
Yeah.
Man, we play like 90s rock over here at the office. We just have a good time. And that song is like constantly, I'm always having a good mood when that pops up.
Like everyone knows the words, you can sing along. Like in the operating room, I like to listen to music too. Yeah. It helps with the staff stays happy, and it's just it's a happy place in the operating room if you're doing things right. And so 90s hits is always a big hit. Everyone enjoys 90s hits.
Exactly, man. So hey, okay, you passed the test, man. That was the main question I had for you. So all right, hey Doc, thank you so much for joining me today. I appreciate you taking your time on that. And let's see if we got any questions does anybody have any questions on our Facebook Live? Any questions so far? I don't know how to use this thing, so I'm going to just finish up.
Speaking of Facebook, I have a Facebook page that's just like Peter Derman, MD, where I post a lot of things about fitness and different things. I actually recently, not too long ago, wrote a blog post about pillows and sleep and things like that, which actually was drawn heavily from the chiropractic literature.
Oh, really?
Patients ask me this all the time, and I'm like, I don't know. I never learned in med school what bed is the best bed.
Oh yeah.
And so my personality is I like to go back to the literature. So I reviewed the literature, which is primarily chiropractic, and wrote up like a little blog post. But those are the kind of things that I like to post online. So if anyone wants to check out the Facebook page, they're obviously welcome to.
Absolutely. And I'll post a link on that too over here. That way people can get on that.
That'd be great.
Dude, thank you so much again. I really appreciate it. I'm looking forward to growing a relationship with you and Texas Back Institute in the future. Okay.
Yeah, me too.
All right, brother. Thanks so much, man.